Hello all, my name is Ravneet Singh and I'm a licensed physical therapist in the United States. In this video, I'm going to provide you some important tips for a foreign trained physical therapist who have started to study for NPTE. For a foreign trained physical therapist, the challenge is not to learn something new. As a matter of fact, every foreign trained PT has a good information on every aspect of the physical therapy and they're ready to see the patients anytime. However, the challenge is to forget the way that you have studied something in your home country and try to learn the same stuff that you have studied in your country, but in a very different way. For example, in many countries, you never get a chance to take multiple choice questions. Instead, you're tested on the subjective questions where you have a case scenario and you're asked to write a detailed answer about it, which may include the differential diagnosis or the possible treatment for the case. As we know, NPTE is all about multiple choice questions, which is why it could be a little tricky for a lot of people to crack the way to answer these questions. I'm going to give you tips on how to study for NPTE if you are a foreign trained physical therapist. There are two basic steps. Step 1, build your basics. Step 2, take the practice exams. Now, it's very important for any NPTE aspirant to build a strong base in every subject. When you are trying to study for NPTE and when you're starting the preparation for the first time, ask a simple question to yourself. Am I confident in my basics, like biomechanics of a joint, their muscle functions, and their nerve supply? Am I confident in neurology basics, like spinal tracts, anatomy, functions of the lobes of the brain, and spinal cord anatomy? Am I comfortable with cardiopulmonary anatomy and the physiology? And if the answer is no, you should take one system at a time and start preparing your basics. I will go with one example, shoulder joint from musculoskeletal system. When you're starting to read shoulder joint, you don't want to start reading conditions directly. For example, you don't want to start reading the conditions like shoulder impingement syndrome, adhesive capsulitis, or Bankart lesion in the shoulder joint, especially if you have not made yourself comfortable with the biomechanics, arthrokinematics, muscle functions, and nerve supply to the joint. To conquer the basics, Final Frontier Timetable tells you the best sources to read, provides you free notes of major areas, and also provides you the assignments to test on individual joints. Once you get some confidence in biomechanics, you want to make sure that you study the examination part as well. Now let's take an example in the shoulder joint. A good physical therapist should know what questions to ask a patient during the examination. And this can be learned by reading patient history from textbooks. Patient history gives you many things, which may include age of the patient, occupation, relieving factors, aggravating factors, mechanism of injury, duration of the problem, and many other factors which are related to the patient's problem. Once you have read the patient history, don't forget to study the observation part of the examination. Because as a PT, you need to know how an affected area looks like. Is there a deformity? Are there any skin color changes? Is there any deformity of the bony landmarks? Observation gives you very important information which could make your diagnosis very strong. After observation, you want to read active and passive range of motion to make the diagnosis even more stronger. While performing the range of motion on the joint, you're looking at if the patient has pain, restriction at the joint, maybe enfield, weakness, atrophy, or hypermobility. And at last, you want to perform your special test to confirm the diagnosis. Believe me, guys, if you are comfortable with all the information that I mentioned above, there are very high chances for you to get correct answers in differential diagnosis for musculoskeletal system. After finishing differential diagnosis, you want to make sure that you have read conditions. And this time, the pathophysiology of the conditions will start making more sense to you. The dots will start connecting. You will be able to make connections with your special test with the conditions given in the question. Not only the conditions, most of the intervention questions will start making sense, especially the ones with a concept of mobilization. We strongly recommend you to build your basics from the textbooks, but not from the review books. You can apply the same strategy to study your neuromuscular, cardiopulmonary system, or even other systems. Now, once you build your basics and once you start getting comfortable with the content, start taking practice exams, which is our step 2. A lot of people ask me how to get confident with the content, how to make decision if I should take the NPTE or not. The answer is very simple. Take the practice exam. Practice exam is the best source to measure your performance. Now, let's assume you took the first practice exam and you score only 50% in the test. Now, 50% sounds very less, but for me, it's not. There's no need to be disappointed if you get only 50% in the first practice exam, because the first practice exam gives you a baseline of your performance. Now onwards, you want to make sure that you score something better every time you take a practice exam. You should review the exam very thoroughly so that you can make improvement in the next practice exam. Your target score for your practice exam is not 75%. Instead, your target score is to score higher than the previous exam. According to the Final Frontier timetable, one candidate may take 6 practice exams in the course of 12 weeks. Sometimes 7, depends on the time between the 2 NPTEs. Which means by the end of the cohort, you should have a graph of your performance through which you can measure your performance with the time. And this will make your decision more simpler if you want to take NPTE or postpone it. Follow these steps and let us know how it works. Remember, consistency is the key to success. Once you made your mind to prepare for the exam, you should be consistently working on the plan. We also understand that the exam anxiety could be the biggest factor of losing belief in yourself. At that time, you should look at the improvement graph that you have made in last 8 to 12 weeks, and this should give you quite a bit self-belief to go for the exam. You can let us know if you're losing the strategies, if you need our team to help you to make a different timetable for you. We'll be happy to provide our feedback on the basis of your performance. I wish you good luck for your preparation for the NPTE. If you have any questions, feel free to email us at enrollment@nptefinalfrontier.com, or you can also visit us at npteff.com. Your questions will be answered by our experts depending upon your unique situation. I wish you good luck. Thank you for watching.